Welcome to this short video in which I'm going to try and explain what the difference between migraine and tension headache is. So I've written down some pointers here to guide me about what I want to talk about in the video. So the first thing I want to say is what the difference between a primary and a secondary headache is, and the fact that both migraine and tension headache are both primary headaches. So secondary headache is actually easier to understand. Secondary headache means that there is some objective medical test that can be done that delivers an abnormal result that we then say is the reason that you have a headache. So for example, if you have a brain tumour and you have a headache from that, that is a secondary headache because there is a structural abnormality that we can say is causing, or that we can point to and say is the reason that you have a headache. Or if you've got metastases in your skull, so if you've got some form of metastatic cancer that has metastasized to the skull bone, prostate cancer for example is a bad one for doing it, then those metastases in the skull, they can also cause headache, and that would be another example of a secondary headache. If you've got an infection in the meninges, that's called meningitis, that's really, really painful. That is another example of a headache that would be a secondary headache. So secondary means that we can find some objective abnormality with the tests that are available in current 21st century medicine that we can say is the reason that you have a headache, i.e. your headache is secondary to that. Primary headache, on the other hand, means that as of the 21st century, with the tests that we have available in the 21st century, there is no objective test that we can do to confirm the diagnosis and find what is actually causing your headache. So both tension headache and migraine, these are primary headache diagnoses. They're the main two primary headache diagnoses. There are more, cluster headache being the third really famous one, but that's quite rare. Tension headache and migraine are the common ones. So primary headache means that there is no tests that you can do to prove the diagnosis, to confirm the diagnosis, that will deliver an abnormal result. All the tests that are available in 21st century medicine will be normal in the case of these conditions. That might change, of course. In 300 years' time, there might be an objective test that can be done to confirm the diagnosis of migraine or confirm the diagnosis of tension headache. And then they'll then be called secondary headache disorders once there is an objective test that actually can prove them. But at the moment, because they're unprovable, because there is no objective test, because you sit down with a doctor and tell them your symptoms and then they deliver the diagnosis just on the basis of your history, that's why they're called primary headache disorders. So what is then the difference between the two of them? Oh, and actually I just want to say one more thing. So there are theories, pathological theories about what happens in these two disorders. In particular in migraine, there's a very famous theory about what the cause of migraine is, about how it's some sort of there's an electrical abnormality in the brain that spreads across the surface of the brain and irritates the meninges, something along those lines. This is a very famous theory. You'll find it even in medical textbooks. It's such a famous theory, but it's an unproven theory. It's a theory that doesn't have anything to do with the way that these conditions are clinically diagnosed. EEGs, for example, which are a test where loads of electrodes are attached onto the skull and which can detect weird electrical activity occurring in the brain. Those are used to diagnose forms of epilepsy, because when people are having seizures, major electrical abnormalities can be detected on EEG. EEG is not used at all in the diagnosis of migraine. If you type in "are there EEG abnormalities in migraine" into Google, you'll get up a bunch of studies saying that there are. However, that has not translated into clinical practice yet at all. So maybe those studies aren't actually right. Don't believe something as God-given truth just because it's published in a journal. Most of what is published in journals is probably wrong. If we were omniscient, if we had God's knowledge of what is actually true, we'd probably see that most of what is published in scientific journals turns out to be wrong. So, as of yet, the theory about the cause of migraine, it is not the definition of what a migraine is. It is not used at all in clinical practice to diagnose migraine. That might change, it might end up being right, but it might also end up being completely wrong, those theories. So at the moment, migraine is a primary headache disorder. There is no proven, clinically used pathological abnormality that we yet understand. Fine, so now I'm going to tell you what the difference then between these two conditions is, and it is completely on the description of the symptoms. So tension headache is much milder than migraine. Migraine headaches are nasty. Tension headaches are a mild headache, maybe 3 out of 10 in severity, maybe a little bit higher than that, maybe a little bit lower than that. They feel like a band around your head. You don't get nauseous with them, and you don't get photophobic. So photophobic means you can't stand light. You want to just go into a dark room and lie down. In contrast, when people get migraine headaches, a migraine headache is much more severe. It makes you nauseous. It's bad enough to make you nauseous with it. You become photophobic. All you want to do is go and lie down in a dark room, take some cocodamol or some other analgesic and sleep it off. So if someone has a headache that is bad enough to make them nauseous and just want to go and lie down in a dark room, that is a migraine. Of course, if someone has a primary headache that is bad enough to make them want to go and lie down in a dark room and they're nauseous and they just want to sleep it off, that's going to be a migraine rather than a tension headache. Tension headache, as I say, it's just a mild band-like feeling around the head. The reason it ends up being a problem, the reason people end up seeking medical attention about tension headache, and many people with tension headache don't ever end up seeking medical attention, but the reason some people do is because they're generally very frequent. It might be the case that people are getting these on a daily basis, and it might be the case that they have them from when they wake up, so they just live their life, their entire life, with this sort of mild discomfort in their head, like there's a band around it, but it's not bad enough that they're nauseous, not bad enough that they're photophobic. And I've written here that they can carry on with their usual activities. They manage to function through it. It's just kind of a damper on their entire life having this. And that's the reason that people seek medical attention about tension headache, because it can become a permanent thing, that you're just living your life with this mild discomfort in your head all the time. So that's the sort of clinical syndrome that is then labelled up as tension headache. In contrast, migraine is usually less frequent. It's usually very episodic, i.e. you might have weeks and weeks where you're absolutely fine, no headache at all, and then you get a migraine and it's really nasty headache. And as I say, it's bad enough to make you nauseous, photophobic. You can still function, but you really don't want to. You'd really much rather go and lie down in a dark room and sleep it off. So that's the sort of difference between these two conditions, tension headache versus migraine, and it is entirely based on the description that the patient gives you. As I say, there is no objective test that you can do to prove one way or the other. It's based on the description. If it's mild and they're coming to you just because it's the frequency of it and they're living their entire life with it, then that's probably tension headache, whereas if it's episodic and really severe, that's going to probably be migraine. Of course, you might need to do investigations to prove that they don't have secondary, that they don't actually have some horrible abnormality that is causing secondary headache, like, for example, a brain tumour or skull mets, if appropriate. So migraine then, I just wanted to say also that there are two major different types of migraine with aura and migraine without aura, and they both obviously are under the umbrella of migraine. So migraine without aura is just what we've already described. It's just a really bad headache that makes you nauseous and photophobic and you need to go and sleep it off in a dark room. Migraine with aura is more fancy. Along with the headache or preceding the headache, they get weird neurological symptoms. Neurological symptoms that can look like a stroke, actually. When they happen for the first time, people often end up coming to hospital thinking that there's something majorly wrong. So the sort of symptoms people can get are visual is the most common. So visual aura is the most common type of migraine with aura. And they see sort of sparkling lights in their vision, so part of their vision is sort of lost, and instead they just sort of see a sparkling array of lights in that area of their visual field, and that can go on for minutes to hours potentially, and then, as I say, it either happens before the headache comes on or it happens with the headache coming on, or etc. Other types of aura, vestibular aura is another one that you hear about, vestibular migraine, where people get vertigo, which is the sensation that the room is spinning. So if you go on one of those things at a children's park that spins you around a roundabout, and then you spin on that for a while and then you get off, that sort of dizzy feeling that you feel when you get off, it's a horrible nauseating dizzy feeling. That's called vertigo, and that's because your vestibular system's completely been messed up by the being spun around. So when you get that, and you haven't just been on one of those things in children's park, so when you get that just at rest, that's pathological. It's called vertigo. There are lots of different things that can cause that, but some people with vestibular migraines get that as their aura. They get vertigo, and it lasts, when you get off one of those things on the children's park, it only lasts for a few seconds and it's thankfully gone. But when people get this because of pathology in the brain or pathology in the vestibular system, it can last for ages, absolutely ages. So in auras, in migrainous auras, it again might last, minutes to half an hour to an hour, potentially more than that. Other conditions that cause vertigo, you can end up with vertigo for days and days. For example, if you get labyrinthitis is one of the major causes of vertigo. It's sort of believed to be, although again it's not something that we ever prove in medicine, but believed to be hypothesized inflammation in the labyrinth, which is the inner ear, which has the vestibular apparatus and the auditory apparatus. You get inflammation in there and it messes you up potentially for weeks whilst it gets better, and you end up with sort of vertigo, can end up with vertigo for weeks. It's really, really horrible. Anyway, it's nothing to do with migraine, but the reason I brought that up is just for interest. So yeah, people with migraine with aura, sometimes they get vestibular auras where they get episodes of vertigo preceding the headache or with the headache. And then finally, I just wanted to mention motor auras. This is a horrible type of migraine. Hemiplegic migraine is one of the most famous types of motor aura, where people lose the ability to move half of their body. So the left arm on the left leg, for example, or the right arm on the right leg. That's what hemiplegic means. It means half paralysis. And that hemiplegia typically happens in strokes, like huge strokes, or even smaller strokes can cause you to become paralyzed on one side of your body. So people with hemiplegic migraines, it's obviously extremely concerning when it happens for the first time, and people often think you're having a stroke initially until that is disproven, and then after a whole bunch of consultants come and look at this patient, eventually they might decide on a diagnosis of hemiplegic migraine, and then it's confirmed, if it gets completely better and then recurs episodically with headaches. But again, it's not a provable diagnosis. There's no objective test that you can do to prove that diagnosis as of 21st century. But it's the diagnosis based on the history of what has happened. So thank you. We'll end the video there.